My name is Khalid Al-Majuri, and today I'm going to present my first current event, which is gonna be about telehealth during the pandemic. I chose this topic because I believe that telehealth had a major improvements and played a very important role in delivering healthcare during the COVID-19 pandemic. Hello. By the end of this presentation, we should be able to define telehealth, know the settings of telehealth, learn the types of interactions in telehealth, know the benefits of telehealth, and finally know the challenges surrounding telehealth. What is telehealth? Telehealth is defined as remotely exchange medical information with the use of electronic communication to improve patients' health. Telehealth impacts the healthcare system in many ways, such as reducing the cost of healthcare service, increased access to primary and specialized care, and finally, improving the quality of healthcare. Now that we know what telehealth is, I'm going to talk about the different settings where telehealth is used. There are many different settings, but we are going to focus on these three. First is home and community based care. This is common for patients with the long term care and patients in nursing homes. Second type is office based telehealth. An example of this setting is when community health aides in rural areas need the service of a specialized provider. The last type of setting is hospital based telehealth. An example of that is when a hospital links with the specialty care hospital for a better management of patients. There are two types of interaction in telehealth. The first type is patient to provider interaction. This is usually for non urgent care or routine management of medical or psychiatric conditions. This is common in checking or following up on long term care patients, such as changes with their condition or if they have questions on medication or treatment plan. The second type is like provider to provider interaction is usually when the provider shares the patient's health information with another provider for a medical decision. This can happen when the patient has multiple providers with different specialties, or if they transfer from one provider to another one. So for this graph, it shows the experience with telemedicine from December 2019 until March 2020. So as we see, there's like three lines. The first one is the patient has tried. The second one is like a patient intends to try. And the third is patient hasn't tried. So I'm gonna start with the first one. So in the red, the patient has tried. So there were like about 8% in December 2019, but this number is increased a little bit in January 2020 by like 3%. And February is still the same. And on March 2020, when the pandemic happened, there's about like 6%. The number increased of patients who have used telemedicine before. So and the second line is showing the patient tend to try telemedicine, and the number is almost the same from December to February. But then in March 2020, the number increased 12%. So people start consider telemedicine during the pandemic. In for people who never used or tried telemedicine before, they're like in December 2019, they're like 73%. So the number almost the same until until March when 2020, when the pandemic happened. The number is decreased from 73% until to be 53%, which about 20% is about 20% of people who never used telemedicine before or tried telemedicine before the pandemic. They start using telemedicine during the pandemic. The number of telehealth visits increased by 50% during the first quarter of 2020, compared with the same period in 2019. During the last week of March 2020, the number of telehealth visits increased 3 times compared with the same period in 2019. These data show how telehealth usage has increased in such a short time due to the pandemic health guidelines. This also shows how important telehealth is in delivering healthcare during the lockdowns. So as we see in this graph, we see telehealth visits from September 2019 until April 2020. On the left side of the graph, we see September 2019, and there are 337 visits. And in October, like the number is a little bit increased, but about to be 425. Then November, almost the same, like 410 visits. So the number like from September 2019 until February 2020 is never reached more than 450 telehealth visits. In March 2020, when the pandemic happened, the number is like increased on for to be like 6,115 visits. And the month after, like April 2020, the number increased like almost 3 times as March 2020. So, and there's like about 17,000 visits. And so, like as we see from September to February, there are not much of people using telehealth visit. But after that, there are many people started using telehealth. There are many benefits of telehealth, especially during the pandemic. Telehealth helps to manage the social distance between people by decreasing person-to-person contact. For example, for patients with the COVID-19 or those concerned that they might be infected, telehealth helps with remote assessment and the provision of care. For people not infected with the COVID-19, especially those at higher risk of being affected, such as the elderly or people with the pre-existing medical conditions, telehealth can provide access to routine care without the risk of exposure of the COVID-19. During the pandemic, many cities were on lockdown, making in-person medical visits difficult. One of the benefits of telehealth is secure access to medical care during the lockdowns. Also, telehealth expanded private access to specialized care on rural areas or areas on lockdown, which can improve the quality of healthcare for many people. Another benefit of telehealth is reducing the exposure risk of patients and healthcare staff that that resulting in decreasing the number of COVID-19 cases. In addition, it reduces the need of personal protective equipment. Finally, it helps decrease the patient costs by limiting the need of travel, childcare, and taking time off from the work. Next, we are going to discuss the challenges to the use of telehealth, especially before the pandemic. First, privacy. HIPAA requires health providers and health insurance companies to protect the patient's data and secure the electronic health information. To comply with this, healthcare provider would need to have business contract with the technology companies that adhere to HIPAA requirements on data protection and privacy. But some healthcare providers are unsure of using telehealth even with these platforms because the financial risk that comes with the single HIPAA violation. So, however, the COVID-19 public health emergency has caused a massive change in telehealth rules and regulations. The Department of Health and Human Services has encouraged healthcare providers to utilize telehealth. Also, the Department of Health and Human Services allowed HIPAA covered providers to use non-public facing remote communication technologies or applications. For example, Apple FaceTime, Facebook Messenger video chat, Google Hangouts video, WhatsApp video chat, Zoom, or Skype, including the texting application of the mentioned applications. So this graph shows the phone and video visits from March to May 2020. And the gray lines represent the total phone and video visit. And the purple line represent the video visit. And the green lines represent the phone visit. So if we, as we see, the green lines is the phone visit, and around like from March or like is increasing. The number is like increasing until like in the middle of April. Then the number start decreasing a little bit until May. But if we see the video visit, it's many people starting like before, like in March, almost like no one using the video visit, but the numbers start increasing when after March, like in April to May. So the numbers start to increasing until like about like for like the same as like the phone. So like now like about May, so the number is like they are like same, like video and phone visit. It's is the same, and as we see in the graph. The second challenge in the use of telehealth before the pandemic was the reimbursement. The concern of healthcare providers not being reimbursed by the Medicare, Medicaid, and private insurance companies, the same with an in-person visit has caused limited telehealth use. The COVID-19 public health emergency has pushed the policymakers to make it easier for the healthcare providers using telehealth to be paid the same with an in-person visit. So this graph shows the value of global telemedicine market. And in the left side, we see like 2015, the the value is like 18.1 billion, and the number increased in 2016 by about like 2 billion, and 2017 the number also increased by like 3 billion. But as we see also like in 2018, the about 3.5 billion. But if we see in the right side, like the number is increasing by more and more. And from 2019 to 2020, when the pandemic happened, so the number increased about 5 billion. And the year after, like from 2020 to 2021, the number increased like more to be like about like more than 6 billion increased. So as we see from 2015 until like 2020, the number is has been increased and more and more. So this graph shows what are the primary telehealth challenges, and there are 4 types of challenges. And the first one is reimbursement. And so like there's 28% of patients think reimbursement is one of the biggest challenges in telehealth. And so if, for example, if the Medicare or Medicaid or the private health insurance company will pay for the in-person visit as same as the telehealth visit. And the second challenge is the physician engagement, which is about 17% of the patients think like is one of the challenge. And in this like physical engagement, this could be like how effective the interaction between the physician and the patients, and if the physician answering the questions or the questions that's like asked by the patient, or if they are giving like the enough information and clear information for the patient so they can understand it, and not using a lot of medical terms that the patient cannot understand. And the third challenge is like the differences law between states, and how like the differences between regulations and the rules from state to another state. And that's like about 48%, more like almost half of patients think that is half of the patients think like the differences in regulation or rules between states is like one of the biggest challenge, and how they is, and it's kind of like half of the patients think about it. And the last is implementation, and about like 17% of patients think like implementation is like is a challenge. And that is like implementation, what you mean like how easy to use telehealth, and like the applications, the technology they are using to receive the medical care. In conclusion, the COVID-19 pandemic served as a turning point for the much needed change in telehealth. The pandemic also highlighted the importance and the potential of telehealth in improving the healthcare system. The improvements and the change in the rules and regulations for the use of telehealth has influenced its massive use during the pandemic. Telehealth telehealth was widely used in almost all fields of medical care, and not only limited for the COVID-19 pandemic. Given the success of telehealth during the pandemic, it raises the question of what will happen to the use of telehealth after the pandemic. Will the regulations on privacy and reimbursement be retained? I would think that medical providers and patients will continue to use telehealth. I have used telehealth during the pandemic, and my experience was very good. I had enough time to talk with the healthcare providers, and I I was able to ask many questions. I didn't have to leave my home, and I didn't have to worry about getting tested for COVID-19 before the visit. When it comes to the regulations, it may not be 100% the same, but the pandemic has opened our minds on the needed change for us to be able to maximize the use of telehealth. This is the end of my presentation, and thank you for listening. And I hope you guys enjoy it. And finally, I just want to mention this is my references list. And thank you again.